Okay, thank you everyone for welcoming me here to Barcelona. This is my first time at Mobile World Congress, and I'm very, very excited to be here. So my name is Jonathan Bloomfield, and I come from a background in sports science and exercise physiology, and I've been using wearable devices throughout my career to help inside a team of backroom team of specialists to help us look after the physical performance of athletes, and the data has provided us a platform to make some key decisions. Well, what I've learned throughout my career is, although the data plays a key role, it's only there to guide, support, and help us modify any plans. But it's the human element, it's the coach, the manager, who's there to make the final call. So in recent years, I've found myself applying similar human performance technologies in a range of different industries now, and most recently within healthcare, using the consumer wearables to improve people's overall lifestyles. So regarding the statistics of the likes of quantified self for health purposes, it's really highly impressive in terms of the uptake at least, and the range of devices that are available. However, it's quite sad to see that the health return it doesn't really live up to the same level of hype as the devices and the process, and usually the process fails within 6 months. Perhaps it's as a result of simply just being accountable to yourself, which is a certain ingredient to make it easy to fail. So changing people's behaviours, there are multiple methods that can be used to change how somebody behaves. But the main influencers can all be found deep-rooted within education and motivation. Furthermore, personalised and managed approaches seem to work far better than generic and self-managed ones. So in between all the prompts, the nudges, and the challenges that we can get provided with, there seems to be also a requirement for a higher level of user understanding of why they're engaged in the process. So they need to have a game plan similar to the sports teams, and then they need to be supported along the way constantly by meaningful rewards and also real consequences as well. So take, for example, last month, just in the UK, the government have identified their intention of cutting benefits of unhealthy people who simply refuse to change their unhealthy lifestyles. So we all remember when seatbelts became law, suddenly everyone was wearing them very, very quickly. So that leads me to today, where I'm in an early stage development of a wellness platform called Fizzy. I'm working in collaboration with the Southeastern Health and Social Care Trust in Northern Ireland, and we're developing this app based on a proven model of behaviour change that currently exists within the NHS. However, this model works, but it's very costly and very touch-heavy. So we are aiming to use wearables to help us guide and validate the prescribed program, which is going to be supported through the interaction of the appropriate healthcare specialists. So we've chosen at this moment in time Garmin VivoFit as our desired wearable, simply because it's incredibly low maintenance. It has a 1-year battery life, it has real-time feedback on the wrist, and with an inactivity alert. So the sync capabilities as well allow us to, for the user, not to even have a smartphone or a tablet. We can use remote syncing via a hub device. And it also allows us to have a 4-week data storage on the device, so it doesn't have to be a constant stream of connectivity. So at the moment, Fizzy will do all the usual tracking that you would gain from the device, but it will create a dashboard with specific KPIs that are tailor-made for that individual. So it'll be personalised, and some of those KPIs will actually be unique to the product. Health progress, however, is going to be made through it's going to be tracked through health assessments. So rather than daily goals, we want to know: are you improving? Are you reaching the important goals that we want to try and achieve? And the feedback's going to occur via the specialists as opposed to being managed by the individual. So a key feature also of the product.
Conclude.
We're good?
Yeah.
Okay.
We have to conclude.
Last call then. Okay, so couple of key features. We'll have, within the program, we'll have coaching and programs. We'll have challenges that people can customize, and They will also keep journal and a diary to track behaviour. We'll have insights and analytics that will be meaningful, show behaviour change, and we'll create a community of users to support people with common goals. But interestingly, all the way along, we're going to be constantly educating the person of why they're engaged in this programme and how they can improve to get better. So we'd be delighted to speak to anyone who shows an interest in the development of our Fizzy product, and potentially we'll see you all here next year. Thank you very much for your time.
Thank you, Jonathan.